stay on time here. We're going to go ahead and get started. Some other people may join, but as we go through, I want you guys to be able to type in the chat, ask your questions, things like that. So I'll start off. Welcome, everybody. My name is Jack Kesselring. I'm the current president of the NCAAOP chapter. And this presentation today is going to be going through some of the updates and things that we have been working on to kind of redo some things in the chapter and get things situated so then we can have more involvement, more activity, and more collaboration as we look at supporting the clinicians, the patients, and the organizations within the state. So starting off, I'm just going to give you a little bit of background of who I am, what we're doing today. So we're going to have an opening and welcome. I'm going to speak about our reorganization and some of our goals. We'll have Dana here that will be talking about the So Everyone Can Move initiative for 2025 and providing some insurance committee updates. And then at the end, we're going to open it up for some closing remarks and questions so you guys can ask whatever you want to about the chapter and where we are and what we're doing. Part of my presidency is going to be being very transparent with you all as well. So I want you to know what's going on, keep you informed, know where to find information, so that we can rebuild and have this collaborative effort across the state of North Carolina. So I'm really excited to have you all here. I'm excited to see all the people who have registered for this call and the engagement that I've gotten over the last couple of weeks. So previously in the chapter, Jim Del Bianco and Shane Coltrane were the president and vice president. So they were doing a fantastic job with the chapter up until this year. And they just needed to step back so they could spend time with their families and their businesses. They were working on programs to support Medicare and Medicaid in the state and made some really good headway with that. So where we are with some of the Medicaid discussions and kind of some of our push for higher reimbursement in North Carolina is because of their efforts. So they've done a fantastic job, and I'm excited to fulfill that mantle and kind of continue this chapter growing and supporting and collaborating with everybody in the state. So as of a few months ago, I was elected by the members of the chapter to be the new chapter president. So a little bit about me. So I am a certified clinician. I've been in O&P for about 10 years now or so. I started here in North Carolina, volunteering and working with a private practice. And then I went to Chicago, did my residency at Shirley Ryan Ability Labs, worked for Hanger in Chicago, moved back here and worked with Jim Del Bianco for a little bit. And then I became the director of clinical education for Townsend Tuan. And so for the past 3 years, I had been doing that and being the clinical educator for them. So I have a really good feel on what's going on nationally in the O&P environment with different manufacturers, suppliers, clinics, what groups are acquiring different things. And I love getting that information from you guys on, how I can support you and how we can make this chapter really be a strong entity and a go-to entity for everything O&P in North Carolina. I have a lot of connections in the state already with entities and groups like NC State's Neuromuscular Engineering Robotics Lab, and with like Duke programs for their postdoc rehabilitation and exoskeletal students. And then, one of the main goals that I'll talk about in just a couple minutes is that I really would like to encourage those groups to come to us when they have questions about orthotics and prosthetics in the state. And I have some ideas on how we can do that. So we're always looking for formal and informal involvement. We have some openings on the board. So if you are interested, I promise it won't take your life away from what you're doing. We want you to be involved. We want to be able to work in this collaborative effort. And whether you're a clinician, a researcher, a patient, a healthcare provider, or someone adjacent to O&P, get involved. There's different things that we need help with, and not all of them are clinically related. All right, so I'm going to talk a little bit about our chapter vision. So of course, we want to support O&P clinicians, patients, residents, and businesses in the state of North Carolina. We're going to continue to support programs and people to showcase orthotics and prosthetics in North Carolina. So having the RTP, Charlotte area, the coast, all these sections of North Carolina that are really big into biotechnology and pharmaceuticals and healthcare, I want this chapter to be the go-to entity for those people looking to find out more about orthotics and prosthetics. So whether that's getting involved with some of the schools like UNC, or whether that's getting involved with some of the organizations in the state like the CAF or Amputee Coalition, those type of entities to run fundraisers in the state, or whether it's even adjacent fields like specialty groups like exoskeleton researchers or bionic researchers. I want to kind of pull all those groups together, so then if they have questions about orthotics and prosthetics, they come to us and we can be that voice. We can be that strong single unity of, hopefully reason in North Carolina about orthotics and prosthetics. So I'm encouraging involvement from adjacent healthcare and academic entities in North Carolina. And I know you guys have a ton of connections as well. So think about, ways that you want to potentially involve them in the future. We want to open membership levels for increased collaboration in North Carolina as well. So then we can have different levels that people can be involved, whether you're a student, whether you're a patient, whether you're a researcher or a clinician. You can have involvement in the chapter and be able to know what's going on, stay up to date with the newsletters, and be involved in, what could be coming in 2024 and hopefully beyond. We're going to continue to fight and support an increased Medicaid reimbursement in North Carolina. So we have discussions going on currently with North Carolina's Medicaid representatives, which we'll talk a little bit more about in a second, and what that looks like. And then we're going to continue to support the National AOPA conference, which is coming to Charlotte next year, and supporting the So Everybody Can Move initiative in 2025, which we'll also talk a little bit about in just a second. So we have a lot of really big things, a lot of really cool things that we will be able to work on and that we'll be working towards over the next 2 years. So chapter updates, this is more of some logistical things that have been happening behind the scenes. So we've had updates to the board. We're also seeking members for some of those open board positions. We have an updated website that has previous newsletters. So if you haven't been seeing or getting those newsletters that have gone out, make sure to update your contact information, which we'll talk about in just a second, and you can see the ones that we've put out so far. We have an updated LinkedIn, so go follow that as well. And then all of our funding and business logistics, such as insurance and liability, all of that makes us an official chapter, are all in place and ready to go. So we have a lot of opportunity now that the foundation and things are set up for this year and the next 2 years to really help and support clinicians, patients, businesses, and organizations within the state. So action items, you've been listening to me talk, you've been saying, okay, Jack, like you're telling me all these great things. What do I need to do as somebody in North Carolina that's part of this chapter? So the action items are update your information so you can at least get the newsletters, stay up to date on what we're working on and, when we need some involvement and what type of activities and programs are going on with the chapter. Pay your dues. So dues are helpful so that we can continue to have these conversations and assign resources to where they're going. We are looking for nominations for board members. So we have some open positions and there is a form out there with a link that we'll put in the chat for the nomination. We are looking for Medicaid information, which we'll talk about as well in just a second. So we have the opportunity that we'll be sitting down with North Carolina state legislatures, and we will be talking with them next week, I believe. Sorry, guys, my Roomba decided to go a little rogue right now. Let me turn that off so we don't get a bunch of vacuuming in the background. There we go. All right, so then follow LinkedIn and get involved. We need involvement, and you're going to hear me kind of beat this message over and over and over again, but we really need people to get involved, especially when we look at doing some of these initiatives and programs in the near future. So whether that's formal involvement as a board position or whether that's informal involvement, I promise we won't take hours and hours and hours of your time away from your family and businesses, especially if we're able to kind of divide and conquer. All right, so one of the big chapter goals for the next couple of years is looking at North Carolina Medicaid discussions and fighting for that increased reimbursement. And Dana's going to talk a little bit more about that and kind of the headway we've taken in the last month or so. We have been able to request a 10% off of the prevailing Medicare rate as an increase for North Carolina. And we'll be sitting down with the legislature in a week or so and talking with them about this and the opportunity to really give them the insight that they can take to the state to really push for this increase. So what we were looking for you as clinicians and business owners is we need to get your top billed codes by quantity. So then we have a good representation of what you guys are billing out in your clinics in the state by quantity. And we'll talk a little bit more about that in a second as well. The So Everybody Can Move initiative is coming up in 2025. So we need your help to become one of the states that can support this program and support our patients. And Dana has more that she'll explain about this. And then next year in 2024, we have the National AOPA conference that's going to be coming to Charlotte. So we really want to band together, really create a good solid entity. So then we can welcome AOPA to North Carolina and really show off the O&P strength in this state. So what we're planning on doing is having a regional meeting in Durham at the beginning part of next year. So then we can kind of rally, get together, have that in-person meeting, get things organized. And then by the time AOPA comes, we'll be a strong single unity entity that we can welcome everybody to North Carolina and show off all the great things that O&P is doing here in North Carolina. All right, so just a quick summary is we're looking at our chapter goals being initially the North Carolina Medicaid discussion. We're preparing for that So Everyone Can Move in 2025. We're preparing for the national conference in 2024 and that regional conference coming up in the first half of the year next year as well. All right, so I've talked a good bit. I'm going to turn it over to Dana so that she could talk a little bit more about the So Everyone Can Move initiative. And then when she's done, I'll have some more remarks and then we'll open up the floor for some questions and discussion.
Hi, everyone. For those of you that don't know me, I have actually been in O&P, involved in the O&P profession in North Carolina since 1997. I am no longer in a patient care setting, but I still want to serve the patients that we have in this state. And I think one of the best ways that we can do that is coming together and supporting the So Everybody Can Move. And it has the support of AOPA, the Academy, the Amputee Coalition, and the AAOP. It really, the NCAAOP. So it is really something that is supporting and bringing together everyone across the country. And there has been a lot of success so far. And I hope that North Carolina will choose to be a part of that going forward. So I'm going to share a very short PowerPoint presentation that AOPA was actually generous enough to loan me. So for those of you, it used to be So Kids Can Move. What they found was that in some states have already done this initiative, that the support was not just for the pediatric population, but for adults as well. And when they saw that this was actually being successful and supported by the different state legislatures, then they decided to change it to So Everybody Can Move. And what it is to create equitable access to prostheses and orthoses utilized for physical activity as medically necessary. And right now, this is a state-by-state campaign. However, their goal is 28 by the year 2028. That means that if 28 states are successful in getting this legislation implemented in their state, then it can then become a federally mandated initiative. So that is the goal. If you will look on this map, you will currently see that there are 5 states where the legislation has been enacted. They are now in the implementation process. So we will actually have states ahead of us that will show us how it has been done and then how the implementation process should be done. And then there were 5 more states that introduced the legislation in 2023. And if you see, we are listed for those for 2024 and beyond. Right now, their agenda for 2024 is full, but that gives us a lot of time to really come together as a state organization to be involved. There's a lot of planning, and I'll go through that in a minute, but it's important that we be united in this. And not only with the clinicians, or clinic owners, we need physical therapists, we need patients. So it's really going to be a very involved movement that's going to include a lot of people that are not on this call, but that we need to start getting that support. So I'm going to go through in a very brief part because politics is not my cup of tea. But this is just an example of the model legislation that they are starting out with in each state. It is important to note that each bill will be slightly different depending upon the state and what's going on. So I will go. It's an act to improve access to prosthetic and orthotic care for adults and children with limb loss and limb difference. And each of these bills is going to have a required coverage, a medical necessity, and non-discrimination standards for coverage of O&P. And then there's going to be a reporting requirement, and then there's going to be the application of the bill. So the main part to look at in the bill is that insurance fairness. It will require state commercial plans to cover and reimburse O&P care at a level at least equivalent to Medicare. Now, do not mistake that to mean at a reimbursement equivalent to Medicare. It is actually talking about that if Medicare has deemed that these devices are medically necessary, then that is what the commercial plans must do. It also will require state commercial plans to cover activity-specific orthotics and prosthetics. And some states have been successful in not only to do it activity-specific, but also to cover shower or water legs as well. And it will require state commercial plans to cover O&P componentry, repairs and replacements, and provide the instructions on the use. So then we get into the medical necessity and non-discrimination standards. O&P was initiated as a part of an essential health benefit under the Affordable Care Act. And then we are asking that the payers require that both everyday and activity-specific care must be covered if the treating physician deems it medically necessary. So we're not just talking about prosthetics, we are also talking about orthotics. And one example that I can think of, and I know that causes a headache for people, especially with pediatric orthotics, are the daytime and the nighttime use, AFOs. It would also prohibit insurers from denying activity-specific O&P care that would otherwise be provided to a patient that does not have limb loss or limb difference to perform the same activity. So right now, insurers will pay for a knee replacement, no questions asked. As long as the medical necessity is there, they will pay for the surgery and the rehab of a knee replacement surgery so that a patient can still be active. Well, the AOPA has deemed or found the language that means that they should also be covering the care that would keep people with limb loss active. It would also exempt orthotics and prosthetics from the reasonable useful lifetime restrictions in the case of changing patient condition or device wear and tear. But keep in mind, in order for this to be successful, the correct compliant documentation will be a necessity. And then that would bring us to the reporting requirement, where that the payers would be subject to legislation where they have to submit a report on the claims to the state's insurance agency. So there would have to be oversight to make sure that they are not denying these devices. And then last is a timeline for legislative implementation. In most cases, it's not something that it passes and then becomes in effect the next day. There will actually have to be a process for the implementation of it. So in order for us to be a part of this initiative and to be successful, the number one part is going to be building our team. So step one is today's meeting. From today's meeting, we want the people here, people in your clinic, your colleagues that are not present, patients, physical therapists, reach out, start spreading the word so that we can develop our core team. Secondly is preparing your assets. I've already had a conversation with Jack. We actually are financially more sound than most of the states that have been successful with this legislation. But it doesn't mean that we won't need more money. It's really going to depend upon the course we take, whether we are going to do a grassroots type of movement or whether we're going to hire a lobbyist. I know in the past we did have the services of a lobbyist, but he was also a veteran. He was also a lawyer who had limb loss. So his fees were nominal compared to most lobbyists. We're going to have to go through the legislative process, which is kind of what I just outlined. We will have the other organizations, AOPA, the Academy, the Amputee Coalition Association, and the NCAAOP holding our hands. We're not going to have to do that part alone. Same with managing the legislative process and then expanding our coalition and collaborating. That means that as we go through this process and we see success, we help other states be successful in this movement. Step 5 is hopefully being able to celebrate our victory. But once we celebrate, which will be very brief, we will have to begin the implementation process for the legislation. And that's going to be a lot of education for the providers in our state. Let me stop share. The other thing is they have a website. AOPA has created a website, and I am going to put the link in the chat. If you will go to this website, you can actually subscribe to their updates. I hope that went through. Nope. You can subscribe to their updates and you will get email updates as it happens across the country and what is going on. I'm already involved with a couple of other people in participating in the lead advocate meetings that they have. They usually have at least once a month. But anyone is welcome that is supportive of this initiative.
Yeah,
Jack,
I just want to highlight, to Dana's point, that this is a massive initiative that we're undertaking as a state. And although it's big, it's a very worthwhile endeavor that's going to help not only the clinicians and people in our state, but the clinicians and people across ONP and other states. So as Dana said, a lot of the big organizations are on board with this and have already been down this process in other states. So we need you and your involvement in order to stay unified, stay collaborative, and be able to get involved and help us move forward with this. Next, we're going to talk, and Dana's going to give a little bit of an update on the Policy and Insurance Committee. So we've had that option as part of the membership for an extra $10 that you could be a part of that policy committee. And so Dana, can you give an update for us?
Sure. And actually, that just reminded me, I clicked on that link on our website this morning and it didn't go anywhere.
All right.
So we may want to work on getting that $10 link back up so people can be a part of that. Honestly,
Perfect. And
that
that's the
money,
feedback that we're looking for. We have things that we still have to update and do. So, if you guys are finding those things, send it to us. Let us know, what you'd like to see and what you'd like to improve on. And if something's not working, let us know as well.
and right now, our goal, as you've already heard, is to use that money to support our So Everybody Can Move initiative. As we are successful with that, we have other issues that we are going to want to tackle. I'm well aware that Blue Cross Blue Shield of North Carolina is one of those. And that is actually a payer that in order to make any progress with, we have to unite as a state. Individual providers will not have any success there. And then with the North Carolina Medicaid, I would actually like to turn it over to Jim for him to give us the update because he is going to be our liaison in the meeting next week with the Deputy Director of North Carolina Medicaid and the Deputy Director of Provider Reimbursements. So Jim, if you would like to update everyone on what the plan is for that meeting.
And you are muted.
Thanks, Jack. Thanks, Dana. So for, I had been serving as the chapter president last year. I've been working, kind of for a year to get to this point. And it started to make some movement just as the transition happened. So fully support Jack, everybody else on the chapter. Jennifer Robinson is there. Dana has been assisting. So just thank you so much. So yeah, the bottom line is that Medicaid right now is like a 30% discount off of Medicare. You can't function. You can't at that level of discount, we can't do what we need to do. That's the bottom line. To make it worse, none of the PHPs are paying properly. Quite frankly, it is so bad. It's hard to fathom how bad it is. So all of these are serious pain. In addition, you notice that you don't get any secondary payments from Medicaid anymore when Medicare is primary, because somewhere in the legislation it's written that, if Medicaid's schedule is met by the primary, then they're not going to pick anything up. So that's kind of a perfect storm to just suffer. And a lot of the, especially pediatrics specific pediatric places are really suffering because many of those children have Medicaid and people have AR out to a year. Bilateral AFOs and prosthetics where only one side was getting paid. They'd pay for one joint, not the other joint on a unilateral AFO. They wouldn't pay for socks when Medicaid policy says they pay for socks. They wouldn't pay for 2 test sockets, but Medicaid 5B policy says they will. So just a long line of challenges going on there. And I assume that everything I'm saying is resonating with every business owner. I don't know if you want to toss something in the chat if you think we're out of line, but is that a fair assessment? Can people maybe, I don't know, put a thumb up or something? Am I out of line here, or is this true?
Yeah, we can invite feedback, and then also we'll have some time at the end to ask some questions and probe a little farther too, if we'd like.
So basically, we have an opening to discuss a raise in the fee schedule. The last raise was in 2012. The whole world is completely and totally different today than it was in 2012. I believe that the discount rate off of Medicare at that time was roughly 10-ish%, maybe 12%. So we're not going to get everything we ask for, right? It never goes exactly like you want or hope. But the deputy director of Medicaid, they are in agreement. They want to help us. They want to give us a raise. They understand the pain that we're going through. Jack, Dana, Jennifer, Jeff Smith with Hanger, Jennifer Robinson, that was with Functional Restorations. A group of us got together and pulled a bunch of invoices, and we just provided a lot of data. Dana put together some great, cost of living index stuff. And so we put all that together. We sent that letter to Medicaid. They were in agreement. So Medicaid is meeting with us next Friday. I'm just kind of functioning as a liaison since I've been going through this process for a year, hopefully I'm doing what all of you want me to do, what the chapter wants me to do. But we are going to talk to the deputy director of Medicaid, and we're going to prepare to meet with the legislature to get this increase. We would love to be at 10%. Now, there's been some discussion about what codes are commons. That has me slightly concerned because I don't want them to say, oh, well, we'll just raise a handful of codes. I'm really hoping to get at a 10 or 12% discount off of Medicare, if at all possible. And then, in our back pocket, in my opinion, we probably need to have a list of codes. If they say that's not possible, well, we probably need to keep the most critical codes at 10 or 12, meaning let's say they say, no, we're only going to move you to 18 or 15. Well, then hopefully we have a list of codes, common codes, all the custom AFO codes, custom KOs, custom KFOs, the most common prosthetic feet and knees, spinal, all that stuff that all of you do every day. And again, Jack's asking for you to give him that list. Well, at that point, we'll have to fight and try to carve out better reimbursement for those. Will we get everything we want? I doubt it. Legislatures and budgets, I'm not 100% sure how that's all going to go, but we're hoping to get some patients with Medicaid who might be willing to advocate when we get a chance to go in front of the legislature. So I don't know if anyone in the Raleigh area, I think that's where the legislature meets, has one patient, that could come with us with Medicaid, a child. I was hoping to get maybe a child and a parent and an adult and just show up and say, look, we are these people this is affecting. So that is our goal. We've started. We'll see where we get. We're going to have to, there's a lot of difficult questions. One of them being, which has me concerned, or I guess probably need to save the rest of the time for the rest of the meeting.
That's okay. We can come back to this.
Do you want to hear more, Jack, or what?
Yeah, I think that's a good update. What we can do is I have some next thing would be just here's the letter that we sent. So that's shared with all of you guys on the screen so you can review that. I have some closing remarks and just some quick updates, and then we can come back to this. So once I finish those remarks, then I'm going to open up the floor so we can have a discussion on questions, comments, anything that anyone wants to share to the chapter or ask about the chapter. We can have this open conversation because we have a good number of people here. So let me just wrap this up real quick with you guys. So I just have a few closing remarks. If you haven't registered for the chapter yet, please do that. Check the website, put in your information, update your information, follow LinkedIn. Like everyone's been saying on this call, we're looking for that unity and collaboration. Now is the time when we need everyone in the state to be involved and at least in some level, be able to collaborate with each other so we can work on these big initiatives that will in turn help everybody in the state. So if you have any questions, you have any concerns, anything like that, you are always welcome to reach out to me directly, or we have the NCAAOP@gmail.com email that you're always welcome to reach out to as well. So now I'm going to go back in and we can open up the floor for any questions, any further updates. If anyone has any constructive, actionable items they want to see from the chapter, this time is for everybody on here to kind of figure out what they would like out of the chapter and how they would like to discuss some things. I think Dana has a hand up already, so we'll start.
I just wanted to emphasize, I know that there has been a lot of movement with acquisitions in the past few years, and that we have big players here in the state. In addition to Hanger, we have Autobot and we have Oser, we have Kenny Orthopedics. And to be honest, a couple of those have offered their support any of these initiatives that we want to be a part of. They are fully supportive of the Medicaid reimbursement, of course, and have been working with us to provide some of that information that's needed. but I want to emphasize that the independent facilities are the majority of the providers in North Carolina. So it is very important that we have not only the voices and support of Hanger and Oser and Otterbach and Kinney, but we need the support and involvement and voice of our independents. That's all.
That's a great point for sure. And I do see that there's some comments in here. So I see Sean with Skyline P&O, you said you concur. And Lindsay, you said very true. And Christopher, you said fair comments. So fantastic. If you guys have anything else you'd like to elaborate on, please feel free to unmute and comment there. I see Rebecca, you have an update on some of the stuff that you're doing. If you want to provide a quick update on that, you're welcome to. Otherwise, we can send out like an email blast or something on an update in the future as well.
Hey y'all, I am a Hanger clinician in the Clayton area, but I've been working with a couple of engineers and designers and otherwise to create tiny little 3D printed legs that can be put on Target dolls. And so just while we're talking inclusivity, if anybody needs one, I have a couple in my office that are ready to rock. We're working on upper extremities. And then my goal is to get these into the schools, to the student societies, so they can learn how to do them. So that way, as they go into their clinics, they can provide these to kids. So if you guys have any questions or you're interested, please don't hesitate to reach out. I would love to get you guys involved as well.
Awesome. Thanks, Rebecca. And Jim, you have your hand up. Go for it.
You know, just hitting my radar this week. I don't know if this is everyone else's radar. I want to try to fix this quickly. And I will say, Dana, I love the useful lifetime thing. That would just be amazing with the initiative that you have. Like, that just sounds heavenly. But we had a bunch of Blue Cross AFOs deny for service lifetime. Those denials were hitting us. You know, we fit them in July and they went through their process and the denials came. And it came to my attention that Blue Cross Blue Shield North Carolina updated their policy to have a 5-year rule on orthotics and prosthetics. Now, I haven't had any prosthetics deny, but we had a wrist splint deny and some AFOs and a knee brace deny for service lifetime. I don't know if I can figure out how to post the article here. It's just the North Carolina policy. So, and I saw on another patient recently from United starting October 1, 5 years. Now, my concern was there was nothing in the article about children needing things, about scoliosis. There was nothing about change of condition there. I've just started the appeal process. So I'm going to start shaking, I'm going to start bothering them and trying to fix that. Has anyone else seen? I just think the chapter may also need to jump on this quickly, because it's bad enough with Medicare, but if every patient, we're going to have to put, 10, 20 admin hours to fit every AFO patient, we're going to start, we're all going to start hurting. Like, we can't do that. So I'm just tossing that out. There's anyone else seeing that or had those denials been hitting? Yeah, it looks like a pediatric one from, I don't know who Chris Annie is, but this is a big deal. Really big deal.
Chris, can you, do you have the ability to come online for a second and tell us what you've been seeing?
Do you hear me?
Yes.
Can you hear me? Okay. Yeah, I've had two recently, and coincidentally, without getting too much, one of them is one of the patient's parents is a podiatrist. It's just crazy. And I've talked to the families. The appeals have been submitted, and my appeal is basically that, obviously for pediatrics specifically, a 5-year RUL rule is absurd. That's been submitted to Blue Cross Blue Shield, and now I've got to wait 30 days for a response on that. But that just hit me, and now I'm seeing new referrals come in and having my clinicians pause on proceeding, because the great clause is that we can't, once that claim is billed and we don't have advanced beneficiary notice, then we're stuck with the tab. So I'm familiar with what Jim speaks of, but we're just waiting and seeing if these will appeal. And it's crazy that we would have to go through this process and create AR that goes out 60, 90, 120 days, especially when Blue Cross Blue Shield, again, not a great payer. You know, you're looking at 70, 75% of the Medicare fee schedule, and it gets lower every time Medicare goes up. So, yeah, I'm familiar with
Go
it.
after that. That's next.
Thanks for the input, Chris. That's good feedback. Dana, do you have something that you would like to include on that?
Yes. And what I was going to say is what they've done is taken the Medicare RUL and are misappropriating it. However, right now, if you're not familiar, there is the Medicare Patient-Centered Act that is in the legislation. We actually have one of the co-sponsors on it is a North Carolina representative, Don Davis. And we are hoping that this one will go through this year, where the RUL will be taken out for orthotics, and it will be the same as prosthetics, that you have to prove the medical necessity, either due to a change or wear and tear. So hopefully if that goes through, that will also trickle down, but we know how long that takes. The main thing I would recommend is that if you are doing these, you have to make sure that your documentation is tight. If it's not, you are not going to be successful at the appeals stage. So just make sure that you do have all your documentation in order from the very beginning. And you mentioned ABNs. I just wanted to remind everyone that an ABN is only a Medicare document. That if it's any payer other than Medicare, I know that there are ABNs, non-Medicare ABNs in OP. However, they are not legitimate for anyone that is not Medicare. Each payer has their own form that you would have to get signed. So you would need to do some research to find out what that form is, or do a pre-service determination. So that's just a little bit of free advice to you guys that are facing this, to try to help you be a little more successful going forward.
And if you need those resources as a clinician or as a practice owner or anything like that, then, you know, this is stuff that the chapter can try to help with as well. You know, this is why we have this committee starting and why we are getting everyone together and collaborative for these programs, is that if you're struggling finding certain information, you know, don't try to reinvent the wheel, reach out to the chapter, and we can try to see, you know, what resources we already have available and what insights we have as well.
No
Jim,
one else
did
is
you have more to
talking.
say?
Yeah, of course. I got 10,000 things to say. I don't want to take up anyone else's time, but no one was raising their hand. You know, I just think as budgets get tighter, as, you know, just the world just seems like, I don't know, it's like every time I turn around, some new disaster is going on. I think the first thing insurance companies, Medicare, the first thing they're going to do is hurt the provider. They're not going to like raise taxes to fix this problem and look unpopular. They're going to try to hurt us. And I don't want to be negative about that, but that's what an RUL does. That's what a 5-year, you know, Blue Cross is like, sweet, we can save a bunch of money. Let's do this. So I think this organized group, and somebody like Jack and Dana are perfect. They're way more tactful than me. I will be tactful at the Medicaid meeting, Jack, I promise. But anyway, I'm just saying this unity is important because we're probably going to need to utilize the chapter, first of all, to raise that Blue Cross schedule. We all have the same at 25%, which is also, that's breaking even at best. You know, we have all these great practitioners with Masters of Science degrees that cost $100,000, and reimbursement hasn't really changed, although the cost of education has tripled since I went through. So this is the solution. And there has to be a unity. There has to be a push to get back to the Medicare allowable with all these private companies. And we have to be ready to be unified and fight things like this rule that came out in July. And I think it just started with United too. We have to, because we're going to have to be ready to hold our ground as they seek to save money. Just my opinion. Total opinion. I could be completely wrong. Just my opinion.
So in my view of the chapter, and as I've taken on this role of the presidency, you know, we see that there's a need for the reimbursement, the policy, and kind of the administrative side of the field. So that's, where we've kind of set up this subcommittee for policy insurance reimbursement. If there's other areas that the chapter needs to focus on, we're open to suggestions, and we can set up other subcommittees for those different things as well. So in my head, I see a very differentiation of different buckets for the chapter. So, we have policy, reimbursement, insurance, billing, kind of as one bucket and one committee that's going to be probably one of our strongest ones as we go through and do these initiatives and we fight for higher reimbursement and supporting the clinicians and the clinics in the state. On the flip side of that, we can have the academic research and kind of business professional outreach and development type of things. So if, you guys come across opportunities where you're partnering with North Carolina State, if you're working with UNC, if you're working with Duke, if you have Cone Health or any of these entities across the state that are looking to get involved or have more education, academic side of things for orthotics and prosthetics, that can be another group and committee within the chapter as well. So we have a lot of options. We have the ability and currently the funding that we can look at some of these programs, see where we want to invest our resources and what makes the biggest impact for the state. So that's why we need your involvement. We want to hear, from what you guys are seeing as clinicians, as boots on the ground, working with the patients and being in the depths of the insurance and policy and programs that are going on, and feed that back to me, feed that back to the board. So then we can, we're flexible. We can adjust as things come up over the next couple of years. Does anyone else have any things that they're working on or anything that they would like to share with the group? Something maybe good that they are excited about? We've talked a lot about the heavy policy and coding and billing stuff. So
I did want to address Jim. He said he didn't know prior authorization is different than pre-service determination, Jim. I am aware that Blue Cross Blue Shield wouldn't need you to get a prior authorization, but you can ask for a pre-service determination. And it is basically where you don't even have to submit as much paperwork as you would for prior auth, but they can give you a heads up on whether there's something they would cover.
I
cool.
know that they're different. I feel like they've told me before they would not do that. So I guess I'll need to reinvestigate that.
You have to be a little more assertive. And since you don't mind not being tactful, that shouldn't be a problem.
I'm just kidding around. At the end of the day, I just want to take care of my family and the people that work here. And they're starting to encroach on that. And I will fight to take care of my family and the people that work here. And we don't have to fight amongst each other in regard to this stuff. If we get paid fairly, there's plenty for all of us, and all of us have unique gifts, unique
Yeah.
This to me is something we can all link arms with and go for it. And I will fight to take care of my family.
Yeah, I'm not going to be promoting a divisive
me neither. Sorry, Jack. Maybe that's the wrong term. Meaning I will politely do whatever it takes, make phone calls, drive down there. And again, I guess in today's world, we probably can't use that word. All I mean is I want to take care of my people, my patients, my employees, myself. That's important to me. Important enough to go to a meeting, to make a phone call, to do whatever it takes.
Yeah, thank you. Jennifer, I think you have your hand up for something.
Yeah, I just sort of wanted to comment on the Blue Cross Blue Shield. Thank you, Jim, for providing that information and bringing that to the team. I remember before we had the ACA guidelines and United Healthcare had a 5-year limit. I mean, I remember seeing plans with one prosthesis per lifetime. I remember seeing that like 15 years ago. So I think we really thank you for bringing this to the team, Jim. Let's really dig into this. It's possible that there's a little bit more elaboration on there where if you do have proof of anatomical change, because I remember in United, although they had that one prosthesis per 5 year, there was, sort of they elaborated on that there. If you have documentation of anatomical change or change in condition, that didn't apply. Okay. Thank you. But let's just really hone in on this. This is a big deal. And we need to get into the nitty gritty to understand if there is maybe some more to that as it is. and fight this. So I'm on board. I mean, I use a prosthesis and I work in the field. So I appreciate having, you know, both perspective of the prosthetic user and the provider.
And this could be, what I'm hearing is that this could even be a program that maybe we set up as resources for the state as well. So we can find, you know, what the ideal algorithm is, gather the resources together, and then we can have that as maybe a packet that the chapter can offer, you know. So if you're trying to do these type of things, then here's the information and resources that are updated and ready to be able to take and run with. So there's a lot of possibilities with that as well. All right, cool. Does anyone else have anything they'd like to share? Any questions, any comments, anything you'd like to get out there?
Well, I just think maybe if we can, you know, can continue to communicate, and if anybody has, like Jim, if you had those Blue Cross Blue Shield appeals in the works with that limitation, if you find that when you provide the documentation that shows that there was anatomical change or change in patient condition and you're successful in those appeals, like, let's communicate that as a team to everybody in the chapter. I think that'll be really useful to know the outcome of those appeals.
Yeah, will do. I think Chris mentioned he had some as well. So although that's not really a solution, because to Chris's
No, not at
point,
all.
yeah,
Right.
I think with Blue Cross you can't actually appeal first. You got to like send in this form, and then if that denies, then you can appeal. So it could be 90 days, 100 days on getting paid. So yeah, hopefully we can make some headway there, and you know, like
and
I
we
said,
can
just
do
take
those.
care of patients.
So everyone in the chapter knows we can do the newsletters and the email blast fairly regularly, and I'm planning on doing a pretty regular one so you guys can stay updated and what the chapter is working on, how the meeting next week goes, things like that. If you do have anything that you want to share, or you're trying to gather information on, or maybe you're running a fundraiser or some sort of something for one of your patients, let us know about those things as well, because we want to be involved. We want you to feel like you're getting, you know, support and encouragement from the chapter as well. So reach out and keep us in the loop with everything going on. I think Jeff had something he wanted to say, but I think he's on the phone briefly. So we can hold off for just a second. Anyone else? I'll take a second to say Elizabeth did put in the chat the information about doing the survey, so you can get credit for this. This does count as a 1.5 business CEU credit. So you being on here and participating counts for that one CEU. So make sure you do that SurveyMonkey credit quiz application there that's in the chat. And then Jeff, thanks for joining us. Did you have something you'd like to say?
Yeah, now I may have missed this, so it's just a question. I'd heard earlier that we may be considering bifurcating from the South Carolina chapter. Was that brought up earlier on the call?
So that hasn't been brought up, but it's a fantastic question. So as we've been looking at making plans for the next year and looking at whether we were doing a virtual meeting or a live meeting this year, we had reached out to South Carolina to try to see if they wanted to combine and be a partner with us. I had not seen or heard anything back from anyone in that organization. So at this time, we're just moving forward as the state of North Carolina and the goals and objectives that were outlined on this call. And in the future, if South Carolina wants to combine, or we want to pair information or initiatives with them, we can. When it comes to things like the So Kids Can Move, that's going to be very state specific. So we're definitely going to have to say, you know, it's North Carolina doing this initiative and have those type of programs set up only for North Carolina. But I'm not against the collaboration. We just haven't had an opportunity yet.
Yeah, well, thanks for that. I totally remember South Carolina being fairly difficult to collaborate and communicate with. So my only comment to that is that the vendors fund the in-person meeting.
Mm-hmm.
And the more folks that you can have attend, the more interest you get from the vendors, which makes a better meeting for everyone. I see Brad on the call and maybe a few others. So if anyone wants to weigh in on that thought process, I think I'm not totally opposed to excluding South Carolina, but somehow we've got to get a larger, group of folks to show up to a meeting so that it ultimately pays back the vendors for all their booth fees.
Yeah, and I'm not saying I'm opposed to having the South Carolina involved. I just haven't found anybody to collaborate with, and a couple of clinicians have reached out, and they were going to go back and explore who was currently, on the board or running that organization and such. And I haven't had any feedback from that. So not excluding everybody, but right now that's just kind of staying to the side, and we're going to move forward as North Carolina objectives. And Dana, go ahead.
I was just going to say, for the past 2 years, I have been attempting to work or find out who in South Carolina would be involved. And as Jack said, there has been no response whatsoever. Even the clinicians in South Carolina cannot even begin to tell you who their leadership is. So even though our chapter hasn't been the most active in the past couple of years, I don't think South Carolina's has even been existent in the past couple of years. What I would recommend.
Kelvin Jones was the last president that I recall.
Well, and I reached out to him last year, and he never responded to anything. So, right. But what I would recommend is that when we plan our meeting, we extend personal invitations to all the clinics and clinicians in South Carolina, as well as even Virginia. I mean, it is a state meeting, but I know that a lot of clinicians from North Carolina go to Georgia's Society of O&P meetings. So we don't have to make it to where it's just exclusive to North Carolina. I think we invite our neighboring clinicians to be a part of it. It's just the planning of it probably will not be in coordination with another state if South Carolina doesn't want to step up.
Yeah, and I'm very much under the idea of anyone is welcome to be a part of our organization as long as they're in or adjacent to North Carolina orthotics and prosthetics. So whether that's researchers or students or residents or other people as well, I'd really like to have that collaboration across the organization, so it's not just clinicians and not just administrative people. It can be a variety of different people that are in or adjacent to orthotics and prosthetics. So fantastic question. Any other questions before we wrap up this call today? All right, the silence is kind of deafening, so I'll take that as no other questions at this time. Yet again, make sure you reach out to our LinkedIn pages, follow the newsletters, make sure your information is updated so that you can keep up with what we're doing and what we're actively planning to do over the next couple months. And then, of course, if you have any questions at all, please feel free to reach out to myself or anyone else on the board, and we'll get your questions answered promptly. Otherwise, thank you so much for joining us today. I'm really excited to be working with all of you and improving orthotics and prosthetics and our visibility in the state of North Carolina. So I hope you have a good rest of your Friday and a great weekend. Bye-bye.